Greetings. This is Dr. Gertie Chimeka Anyanwoke, Infectious Disease Specialist practicing in Baton Rouge and Gonzales, Louisiana. Today's date is March 26, 2020, and this is another honest update on coronavirus disease 2019. As the world reels from the impact of this pandemic infection, as the rates are rising in the United States, especially in New York and my home state of Louisiana, I cannot help but notice the increasing number of infections in my other home, Nigeria. But as an infectious disease physician, I implore you all, do not panic. What we need to do is to know how to respond to this pandemic. In my previous recordings, I have talked about frequent hand washing, social or physical distancing, sanitizing, self-quarantine, etc. So today, I'm going to talk about if we get infected, how does the virus affect our bodies and how we can manage it to get the best outcome. Please remember that most people who are infected by this virus will recover entirely from it. What does coronavirus do to the human body after infection? Coronavirus infection is now mostly a person-to-person transmission via respiratory droplets. When this occurs, virus released in the respiratory secretions when a person with infection coughs or sneezes or talks can infect another person by making direct contact with parts of your face. Infection can also occur when we touch a virus-contaminated surface and then touch our face, which includes our nose, our mouth, or our eyes. Typically, droplets do not travel more than 2 meters or 6 feet and does not linger in the air. However, in one recent report, the coronavirus remained viable in aerosols under experimental conditions for at least 3 hours. Given this uncertainty about mechanisms of transmission, I personally will recommend airborne precautions with face masks until we know more. However, face masks are now in short supply in the United States at this time. My recommendation is to make your own face mask if you can. Coronavirus 2019 has been detected in blood and stool specimens. However, fecal-oral transmission did not appear to be significant in the spread at this time. What is the period when you can be infected? At this time, the duration of viral shedding is not certain, as it could range between 8 to 37 days. However, detecting coronaviral RNA does not necessarily mean viral infection, as the person may not even have any symptoms at all. We suspect that transmission might be likely in the earlier stage of infection. More study is needed here. There is also a report of transmission of coronavirus disease 2019 from people with no symptoms or during incubation period. Again, more study is needed here. How does the coronavirus disease behave clinically? The incubation period for coronavirus disease 2019 is said to be within 14 days. It could be as early as 4 or 5 days after exposure to the virus. What is the spectrum of illness severity? This ranges from mild symptoms that would include no symptoms at all to mild pneumonia. These constitute about 81% of the cases. Severe disease, which includes difficulty breathing and pneumonia, these constitute about 14% of the cases. Critical disease with respiratory failure that will require ventilation and ventilators, shock, or other organs failing is about 5% of cases. Overall case fatality, 2.3%. This means 2.3 people may die out of every 100 people that are infected. Amongst asymptomatic and non-critical cases, no deaths. Most deaths occur amongst the following groups: the elderly, people with other underlying medical illnesses like heart disease, chronic lung disease, diabetes, hypertension, cancer, etc. Please note that any age group can get this infection. I realize that I have just given a lot of technical information, but it is in my bid to best inform the public as to why the coronavirus disease 2019 is concerning. But we have to remain calm and not panic while we manage it and return to normalcy. How do we manage and treat the coronavirus disease 2019? There is no vaccine yet for coronavirus disease 2019, and researchers are still working on it. There are tests, but at this time, they are not readily available in the United States and other parts of the world. The mainstay of managing this virus is to self-quarantine and to treat the symptoms. For example, we can treat fever with Tylenol, the generic is acetaminophen, and we can treat with paracetamol. We should avoid ibuprofen because it may not agree with the virus. For people that are having fevers, they could drink plenty of fluids. These include usual home remedies for the common cold. If cough worsens or you develop difficulty breathing or other worsening symptoms, call your doctor or follow the directions of your local health authorities or call for medical emergency. In conclusion, I am appealing again to everyone to not panic, even as I state that this coronavirus infection may linger for a while, especially as different countries are going through different phases of the disease. With social distancing, what we are trying to do is to prevent overwhelming the health system all at once, so we can allow for a more proportional patient to equipment ratio. A word about social distancing. Please, social distancing is about physical distance. Still endeavor to socialize with your family, with your friends and others via telephone, video calls, text, etc. Because isolation on its own can lead to depression. Finally, please, only get your information through reliable sources like the CDC and others in the United States and NCDC in Nigeria and others in different countries. My people, please stay safe. With much love from Dr. Gertie Chimeka Anyanwoke, Infectious Disease Specialist practicing in Baton Rouge and Gonzales, Louisiana. Stay updated with future content. Please like, share, and subscribe to this channel. Thank you.